We're also going to bring a lot of medical apps and technologies. Medicine is obviously changing. You should watch out for your own health besides your doctors. And you can get a lot of this technology right on your iPhone and things that can actually help you. One of my favorite apps is actually My Fitness Pal. And My Fitness Pal, you should look into it. If you want to lose weight, you basically put in what you're having for breakfast. It has a memory of it and it keeps it for the next day. You can put what you have for lunch and dinner and it gives you all the calories, and you put your weight goal that you want to reach and it will tell you whether you're doing the right thing. Are you eating too much? You can adjust your dose, the amount that you're taking, and help you. There are 3 medical apps that I want to talk to you about, and this one is called iDoc24. iDoc24 is actually quite interesting. You take your iPhone, you take a picture of a lesion on your arm, you send it to these doctors that are on the app, and they will tell you whether it's a likelihood of being a melanoma or not, what kind of lesion it is, and whether you need to come and see the doctors or not. And it can save you a lot of money. iDoc24, these are 3 apps that you really need to keep it in your phone. The other one is called Amwell, and this is something that you can see your doctor 24 hours, 7 days a week. They have a list of all the doctors. You can log in, and without any appointment, you can ask them questions, and they're basically free advice. And you have to be careful about some of the advices, but it's there for you. Amwell. And finally, the 3rd app is called Patient.io. And this is obviously a way for the doctors to be connected to you. Patient.io is that you can share your labs, you can share your data with your doctor in a private setting, and it's really important and helpful. So I want to tell you a little story I was in Bermuda about a trip a couple of months ago. And this was about some cardiac trip that we were trying to bring awareness from Lenox Hill. We put an Olympic team together from cardiologists, neurosurgeons, myself as a urologist, and we went to Bermuda. And I got to know this very special guest of mine and a friend of mine now, David Langer, who is the chief of neurosurgery at Lenox Hill Hospital. The man is really funny, besides the fact that he's a superb surgeon, and some of the stuff that he does, even for a great surgeon like myself, is very interesting. So he does a lot of bypass on AV malformations. I'm going to let him talk a little bit about what he does. And I promise you, we'll bring David Langer back in the future to talk about his field. But while we were on the trip, I learned a lot from him. And what I learned is that he's actually a great innovator. He has invented this medical app that can advance your health. It can really help you with a lot of data and information, with videos and other things. And I want to welcome our good friend, Dr. David Langer, Chief of Neurosurgery from Lenox Hill. David, good morning. How are you?
Morning, Doc.
All right. So first of all, tell me a little bit about what you do every day at Lenox Hill Hospital.
Well, the majority of my clinical focus is sort of running, administrating, and working in the Department of Neurosurgery at Lenox. We started this department a little less than 2 years ago, brand new department in New York City, the only Park Avenue hospital.
Good, you like that.
I like that line. That sounds great.
Well, I think what's unique about Lenox Hill is that it's like a family. It's big enough to be one of the greatest hospitals in the city, but it's also small enough that I think the doctors really work together like a family. That's certainly, I've been there about 2 years, and that's a feeling that I get. And a lot of it is because of you guys just welcoming us. So I'm glad that you're here. I know you take care of a lot of really cancers and AV malformations and aneurysm in the brain, and I promise you we'll bring you back. Tell me about this app that you have invented. Who can use this? How is it going to change our healthcare, and who can benefit from it?
Well, this sort of started with the idea that patients weren't getting the information that they really needed to make good decisions and to understand their medical problems. This project began 4 years ago, actually. It's morphed into something much greater, primarily because of the change in government and the way that hospitals really have all of a sudden really are forcing themselves to make the patient experience and patient satisfaction a major priority. Even a year and a half or two ago, this wasn't as much of an important issue because the government and the way that you were paid made no difference whether patients were happy or not, but that's completely shifted. And so all of a sudden there's a lot of attention on apps like this that are really designed to help the patient understand their problem. And so really, in summary, what the app does is instead of me giving you information through a portal, which is basically the way that patients can access their healthcare records on the web, but usually through a hospital site, we're creating new, unique forms of medical record using social networking type of strategies, such as texting, photographs, movies.
Okay, so let me
videos.
understand this. So I'm a patient, I'll come to you and you
Right.
see me and you examine and you basically look at all the CAT scans and MRIs, and you basically say that there's something in the brain that needs to be either operated on or not operated on. Then how do we use this app moving forward? The patients that are listening or people that are listening to the radio station, where do they get this? What stage of research is it? And how is it going to really benefit? Are they walking out with a flash drive that has all the information in it, or they can just go to their iPhone?
So when patients come into my office starting actually Monday, they're going to basically, we are going to sign them up for our mobile app. So they'll download the Lennox Hill Neurosurgery mobile app onto their device, and then that gives us access to send whatever we want to them. So during the first office visit, for example, most patients come with a CD or some films. So instead of leaving with the same CD, what they can go home with is a video of my voice or my nurse's voice going over their films right in front of them so they can ask questions, and it's all recorded. And then that movie that's generated on a computer desktop is then immediately sent to their mobile device into
So
the
they
app.
will get all the information.
So then they hear me talking, they hear themselves talking, they can go home and show it to their loved ones.
All right, so we're going to take a quick commercial. When we come back, I want to talk to you a little bit more. So we're going to take a quick commercial and we'll be right back. All right, we're back again with our brand new show on AM 970, World Health News. My name is Dr. David Samadi. Our phone number here is 877-970-2999, 877-970-2999. And we'll be talking about all different issues that involves health. Not only great news from all over the world, but also from US. But we're also going to be talking about important things that you need to know as a patient. What's going on with your insurance? What's going on with your hospital stay? What other apps that you can use and technologies to improve your life? And certainly we'll talk about major health companies, whether they're doing the right thing or whether you should invest or not. So it's really looking at everything. We're here with my good friend and our guest, Dr. David Langer, who's a chair of neurosurgery at Lennox Hill Hospital. He's not only a great surgeon, but he's also a great innovator, and he has invented this app that's going to help you. It's called Lennox Hill Neurosurgery app. It's already ready, going live this Monday morning, so I congratulate you. And, you know, have you been in a situation where you go to the hospital, they basically, or you go to the doctor, you have the visit, and you come out an hour later, you have no idea what just happened. You have no idea whether you need a surgery or not. They rushed you through it. You sit in the waiting room for 3 hours, and it's like, what happened here? Or you're in the hospital, and you go home. You don't know what your labs are, what that CAT scan showed. You're just basically clueless. Wouldn't that be great if you have one of these apps that David has created, where when you go home, right on your iPhone, you will see your labs, your data. You have Dr. Langer that will explain to you what went on. I think this is a very interesting app. So, David, tell us, am I presenting it well? Is this
You're a
the way?
smart guy. I only discussed it for 30 seconds with you. Yeah, that's basically the idea, is that so much happens during that. You know, you're taking someone with no understanding of their medical problem, whether it's a hangnail or cancer, and you're putting them in a foreign environment with a brand new doctor. And then they don't remember anything, because after you start talking, it just flows right through their head and it's gone. It's like vapor. And so what we're doing is we're taking that, we're memorializing that moment, creating a highlight reel of whether it's an office visit or even when they're in the hospital. We can upload things that are unfamiliar to the medical record in the past.
And we get a video summary of what went on with you talking to them, which is great, because if you want to get a second opinion, you always have that record for yourself. The name of the app is Lennox Hill Neurosurgery. With Dr. David Langer. If you have any kind of brain issues or mass or aneurysm and AV malformation, he's your guy. I appreciate you bringing this technology. We look forward to seeing you more in the future. Talk about like some of your surgeries, and he's also a great fun, and I always enjoy having him. David Langer,
Thanks,
thank
David.
you very
Thank
much.
you.